conference. Leading off today will be Joost Kummeling. He's going to be giving a speak about the natural history study that's ongoing. And so, Joost, I will turn it over to you. Thank you very much.
Thank you. Thank you very much, Jeff. I hope I will share my right screen at this moment. Let's see. I think it's this one. If everything is right, you can now see my presentation. Yes, okay, that's good. So, thank you very much, Jeff, for introducing me. And thank you all for joining in this very exciting conference. It's exciting for me as well. Today, my name is Joost Kummeling. I'm a medical doctor and a PhD student working under Professor Kleefstra in the Radboud UMC in Nijmegen in the Netherlands. And today I have been given the opportunity to speak about my research. And today we'll give an update on the natural history study that I'm currently conducting. And let's see. So Jitske Kleefstra is sort of the main person regarding the Kleefstra syndrome research here in the Netherlands. And she has gathered a team together in the Radboud UMC, the University Medical Center. And that team consists of multiple people with all their own expertise. And their expertises range from Kleefstra syndrome research in mice, Kleefstra syndrome research in brain cells, in fruit flies. And I am one of those clinicians who focus on Kleefstra syndrome in humans. My work is more or less a continuation of the work that has been done by Carlijn Vermeulen. She's a children's and youth psychiatrist who works here also in the Radboud UMC. And she wrote a thesis about psychiatry in Kleefstra syndrome, which I'm going to tell something more about. And what she saw is that people with Kleefstra syndrome may experience several psychiatric disorders like major depressive disorder, psychosis, regression, which is a loss of functioning, and which can be, in fact, is a loss of certain skills. It can be motor skills, can be communication skills, and also people with Kleefstra syndrome may experience problems with sleep. And you can imagine that sleep problems are maybe the most debilitating, the most horrible problems regarding the whole family, because if a child in a family doesn't sleep, the rest of the family doesn't sleep, and if I miss one night of sleep, I'm the next day I will not be functioning at 100%. But let's say if I do not sleep or sleep very very badly during a whole week, well, I'm almost a different person after 1 week. So it's a very important problem that may occur. And we want to tackle that problem as well. Often the major depressive disorder or psychosis can present in a different way in people with Kleefstra syndrome than in other people than other clinicians are used to, like which Carlijn Vermeulen already said with major depressive disorder, that often a major depressive disorder does not present as a typically sad mood, but more as an irritable mood. So these kind of things, as they present differently, makes it quite hard to diagnose and therefore also hard to treat. And we do not have standard treatments ready for these kind of problems that may occur. This is the main thing that I want to tackle, and I'm going to explain to you in this study. So in 2019, we set up a patient study, which has a follow-up of 4 years. We want to follow the participants for a couple of years to see how they're doing. And we are collaborating with multiple centers around the world to make this all happen. And we started in April 2019, so it's now almost April 2022. So we've been busy for a couple of years. We have some data, but we're not there yet. The first objective we set out to fulfill is to understand the natural history study of Kleefstra syndrome, and we want to know its natural course. We want to know every aspect of it. What is it? What does it mean for the patient? What does it mean for the family? But secondly, we also want to understand the regression that is observed in Kleefstra syndrome, and the effectiveness of olanzapine. Because this is a sidetrack, olanzapine is a drug that is mainly used in psychiatry, mainly on people with psychosis, like schizophrenia. And Carlijn Vermeulen saw that the olanzapine can have quite a positive effect on Kleefstra syndrome patients who experience regression or psychotic disorders. Although this is promising, it is not yet confirmed as such. For the inclusion of the study, we included people with a Kleefstra syndrome diagnosis, of course, from which we were able to obtain a written informed consent, and who are 12 years of age or older. This is because the main psychiatric problems that we want to look at occur later in life, so not really in childhood, but after 12 years of age or older mainly. There are some exceptions, but I will not go into that. But we want to focus on 12-year-olds or older. And to map all the different aspects of the Kleefstra syndrome that we want to learn from the participants, we set out to establish a test battery specifically designed for this patient group. And this test battery consists of questionnaires and neuropsychological and psychiatric tests. And for you, it's important to see that in the bottom line, those are the names of the tests that we are conducting. And we have, as part of the questionnaires, we ask the parents / caregivers of the participants things like, we want to know about the participants' communication skills, we want to know about their daily functioning skills, and we want to know about their social skills. And to give a few examples of the questions that are in the interview, does the communication-wise, does the person know the meaning of at least 10 words? Can the person indicate a preference if allowed to choose between things? Like daily living skills, is he or she able to eat with a spoon? Is he or she able to make his or her own bed? And regarding social skills, we ask questions like, does the person express two or more recognizable emotions, such as happiness, sadness, fear, or displeasure? And can he or she keep a secret for at least one day? And these three things that I just mentioned, the communication skills, the daily living skills, and the social skills, collectively, we call that adaptive functioning. And the adaptive functioning is the main outcome of the study. It's the main thing that we are looking at. In addition to this, to adaptive functioning, we look at sleeping problems that may have occurred or may occur, any mood disorders like depression, or any symptoms of psychosis that may occur. And with the neuropsychological tests, we look at signs of autism. We look into the learning and memory capacities of people with Kleefstra syndrome. And in addition to that, we also look into the visual motor integration, which is sort of a fancy word for the collaboration between the seeing of things and in a reaction to that movement of fingers of hands. And this is a sort of an overview of all the tests we do. So this is quite a complete test battery where we've worked to establish. And how does this work in practice? Well, we follow, as I told before, we follow the patients for a couple of years. So when we've included them in the study, we do the tests, so the questionnaires with the caregivers and the tests with the participant. And after a year, we do the same thing, and after another year, we do the same thing, and year after year, we do the same battery of tests. And we want to see if there are any differences over time. So, are there any? Does any regression occur, or are there any other problems that occur, like mood disorders or such? And in the case that there might be a psychotic disorder that arises, we advise people to start olanzapine. That's the antipsychotic drug that I told you about a few slides ago. We cannot do this by ourselves because we all are in the Netherlands and it's a pretty small country. We can do quite a bit, but we need collaboration around the world, and therefore we also started a collaboration with Boston Children's Hospital, who have started to gather patients as well, and have included quite a substantial amount of participants for the study. And in the beginning, we calculated that we needed around 60 people with Kleefstra syndrome of 12 years of age or older to participate in the study to have a decent bulk of information. And our idea is to have to include 40 patients here in the Netherlands and 20 patients somewhere else, so in the rest around the world. And in this case, Boston Children's Hospital is sort of being on the forefront there. And this is the update on the study. So at the moment, we are at 39 inclusions in the Netherlands, and Boston has made 13 inclusions on their side for the rest of the world. So in total, we are at 52 participants with Kleefstra syndrome in our study. Of those 52, we've split them into 2 groups, and it's maybe a bit more technical, but we split them into the early detection cohort and the late detection cohort. And what this means is that in the early detection cohort are the people who have been without any problems, without any psychotic disorders, or who have had psychotic disorders but were included within 2 years since the start of the symptoms. And sorry, I have to take one step, one moment. And in the late detection cohort, we have Kleefstra syndrome patients who have had psychotic disorders already, and were included more than 2 years before, more than 2 years after the first symptoms arose. And this is the main state of affairs at the moment. So in the early detection cohort, we have 32 people now, and in the late detection cohort, we have 20 people. And at this moment, we have to say that inclusion has stopped. We're sort of at full capacity, and because of the whole Corona pandemic, which has influenced all of our lives, we were not able to get the 60 that we wanted to have beforehand. And we expected to have 15 people in the early detection cohort to be using olanzapine because the start of psychotic problems. But at this point in time, there are 9 people in the early detection cohort using olanzapine. Because we did not get to that 60, we are looking into sort of alternative analysis to get the most out of our data, and currently that seems quite promising. And in addition to this, of course, we have started up a psychopharmaco survey, which can be found on the kleefstrasyndrome.org website, but also on the iDefine website. And this is in addition to the study to get as much information as we want, sort of to help us with our first objective, sort of to understand the whole natural history of the Kleefstra syndrome. This survey is intended for parents or caregivers. It's of course about the Kleefstra syndrome patients who have or an EHMT1 variant or a 9q34.3 deletion. And in contrast to the other study that I mentioned, this survey has no age restriction. So we want to gather as much information on as much people with Kleefstra syndrome as possible. And with the survey, we are hoping to collect several things. It consists of 7 parts. We wanted to gather general information on the participant, but also medications that are used, which ones are effective, which ones aren't. We want to know if there are any regression periods, how sleep is going, and if there are any comorbidities, so if there are other health problems at the moment. If it's possible, we also want to collect information about the treating physicians, so we can contact them and ask them for more information about the person. And of course, there's also some room for remarks if there are any remarks regarding the survey. A bit of a practical aspect now. The survey itself, it takes about 20-30 minutes to complete if you want to take a look. And a tip I can give you is it's important to gather relevant medical information before starting, because well, otherwise we will be asking you, of course, a lot of things about medication, all kinds of medical records. So it's important to already have that handy. Up until this point, we actually have 33 surveys completed, so that's quite a significant amount. But we were hoping to gather more with your help. And when you start the survey, make sure you finish, because sometimes people sort of forget they start it up and they think, okay, it's a lot of work. It's a bit more work than I thought, and they close it. So we have sort of empty files, which is not really handy for analysis. But yeah, when you start, please make sure to finish. And this, what I said before, this survey is available via the kleefstrasyndrome.org website or the iDefine website. And I will give a link to the survey at the end of the presentation. So I'm reaching the end of the presentation already, and there are some key points I want to give you. So good to know that here in the Radboud UMC, we are currently working with a strong team with expertise on multiple disciplines. And we want to tackle the diagnosis and treatment issues of the psychiatric disorders in Kleefstra syndrome. And despite of the COVID issues we have had, the study is doing quite well. We managed to still keep on gathering information during the whole pandemic. The inclusion has been closed at this moment, and I'm hoping to get results to you soon. And especially to the families, I wanted to let you know that you have to be aware of the sleep disturbances and regression, as sleep disturbances may be a sort of precursor for a loss of skills. And you can contribute to the study via the survey that I mentioned. I want to especially thank all the people from the Radboud UMC who are part of the whole clinical team on this study. I want to thank all the lovely people from Boston Children's Hospital and all the people from iDefine who've made this conference possible and have given me the opportunity to speak here. I'm obliged to thank also these people from the Noun Project. I used some of their images during this presentation, and of course, lastly, I want to thank all of you for listening to me and hopefully paying at least some attention. So thank you very much. Here's the QR code for the survey. If you want to participate, you can sort of aim your phone at it and go directly to the survey, or maybe save it for later. And well, if you have any questions, please, I think it's wise to ask them in the chat, and we'll try to answer a couple of them. Thank you very much. And I will now stop sharing.
Thanks, Joost. That was, as always, super informative. And I wanted to try and cover a couple of the questions that are in the chat. And again, if everyone can just continue to put any questions in the Q&A and utilize the chat to kind of have conversation between each other, that would be super helpful. One of the questions, and I'll open it up to you, but if any other panelist would like to weigh in, certainly please feel free to do so. But the kind of question was, have you seen KS patients that are exhibiting psychosis having conversations with themselves? I've seen anecdotally evidence of this, but have you all seen clinically any experience with this?
Well, as I mentioned earlier, it's quite difficult sort of to have a good idea of a psychosis in a person who is experiencing Kleefstra syndrome. If a person without the developmental delay without intellectual disability has a psychosis, it's sort of, you can easily detect it, since that person might communicate to others like I feel like I'm being followed, or indeed talking to other people in the room who aren't there. And because there's a wide variety of development within the whole Kleefstra syndrome group, there may be some people who have the right amount of communication skills to actually have sort of conversations with people who aren't there. And I've seen a couple of patients who have actually showed psychotic symptoms like that. But on the other hand, there are also people who have with a really different subset of symptoms. Yeah, but it's indeed it can occur. Yes.
And then there's a question, and I want to provide a little bit of context just from my vantage point, but there's a question around olanzapine, Zyprexa, and CBD. And I would just kind of take a step back that, ultimately, these are all kind of treating symptomatic challenges of the condition, right? Like there is a big push on our behalf, and I know as well as the team at Radboud and further about, let's get more granular and kind of find root cause, right? And so we can treat symptoms as much as we want, but there is probably a shelf life where you start becoming, something will either wean off, you become accustomed, your body and biologically shifts and starts not responding the same way. And so, we want to continue to drill deeper. And that's where a lot of the focus on our research efforts comes in. We can use some of these off counter or readily available things, but they're not necessarily customized to Kleefstra, right? So I think that's an important footnote to have here. And then as it relates to CBD, I did put something into the chat. If there's interest from the community regarding CBD and just getting more information, we actually have a member of our SAB, Dr. Allison Mootri, who has presented on the effectiveness of CBD in some neurodevelopmental conditions. And so it is worth discussing. Just please indicate your interest to us and we can take it from there. One other question real quick, Joost, is will folks be automatically included into the second study or sign in there as well? It says they're in the first study that you mentioned. So do they have to reach back out, or are they automatically transitioned into the secondary study?
So the secondary study is mainly for the people who aren't who didn't have the opportunity to join us in the first one. So we have at least our means are sort of limited, and we could only include so many people with the means that we have. But we still received a lot of questions around the world from people who wanted to participate in one way or another. And for those people, we've set up this specific survey so that they can contribute in their way to our research, and we can get information from them as well, which we will benefit. We hope we will benefit them from them, and we hope that you can benefit from them as well.